Rishi Sunak wants to cut medical waiting lists. It's part of his plan. The total number of people waiting for non-urgent treatment stands at 7.2 million, and or it stood at 7.2 million when Sunak made his pledge in January, and now it's gone up to 7.7 million, I think. But Steve Barclay, the health minister, has said that has drawn attention instead to the other side, the 1 million appointments and procedures that have been cancelled since nurses started the industrial action in the NHS last December. I think it's not just that; it's also the general go slow of the whole system, and to blame one bit and say, the doctors, the nurses are to blame for a go slow in cancer treatment, for withholding time-sensitive cancer treatment. Well, yes, but the government is to blame for the build-up of this extraordinary backlog. It's not the only backlog the government is building up. It's got the backlog in the migrant problem as well. It's a perpetual backlog. What we need is political laxative. Now, as somebody who's caught up in that backlog, there is no way out. That backlog encompasses every possible aspect of medical access, whether NHS or private. It doesn't make any difference. The whole thing is clogged up, and Britain is not functioning medically. So I'm waiting for Suella Braverman to chirp about migrants coming over to the UK in search of our excellent NHS. What utter rubbish. It doesn't matter what skills we have if the skills aren't working. It's wrong. Nor, incidentally, is it reasonable for Dr. Vishal Sharma, who's the BMA's Consultants Committee chair, to say of the Secretary of State, of Steve Barclay, it's incredibly rich of him to invoke time-critical procedures when his government has overseen a sharp increase in waiting lists that saw them reach record levels even before any strike action took place. He's right to point that out, but it's not a matter of this person is more to blame than that person. The point is there are people waiting for procedures. They're not getting those procedures. When they get procedures, they're carried out with error. There's error running through the system because everybody is overworked. Everybody is stressed and trying to cram in whatever they can to beat these backlogs. And meanwhile, we've got the bureaucrats, either in the government or directly in the hospitals themselves, creaming in the money for no purpose, because they don't get it right. If you get a letter which is full of spelling mistakes, if you get a letter which is 2 weeks after it was dictated, if you get a letter and a telephone call which says, why didn't you turn up for a blood test 2 weeks ago, which you knew nothing about because you hadn't got the letter, you have to say the bureaucracy is chaotic. And if the bureaucracy is chaotic, why aren't we sacking most of the bureaucrats? Because what's the point of having them all? What's the point of having these grand bureaucrats who are making more money than the consultants, more money than the nurses, more money than the doctors, if they are making so many routine mistakes? And say, no, they're not the ones actually filling in the forms. That's the doctors who are doing that. Well, hold on a minute. So what are the bureaucrats doing? Please tell me. Can somebody in the comments section, maybe an NHS bureaucrat, tell me what justifies their pay? What justifies their job? because I think some serious changes, some serious economies can be made in getting rid of a lot of the bureaucrats on the NHS trusts. Just get rid of them. If necessary, close the trusts and start again. But there is no point in paying for all these bureaucrats when the system doesn't work, when the people who are actually doing the real work are tired and frustrated that they're not being paid enough, and when the bureaucrats are being overpaid. Just explain that one. It doesn't matter who blames who, whether it's the strikes or whether it's the backlog. Doesn't matter. The bureaucrats are still raking it in at the expense of patients. I have nothing but contempt for such bureaucrats. I promise I'm going to start naming them soon if something doesn't happen.